The very first question to ask is, what is LASIK and how does it fix the vision? So we're going to look at a model here of what happens when an eye is out of focus. This is the model where an eye is nearsighted. The light rays are focused in front of the retina. This is the front of the eye, the light's coming in. This is a model of farsightedness. It's behind the retina. This is a model of astigmatism. You can see two different points of focus. And with LASIK, what we're doing is basically reshaping the surface of the eye, the cornea, to get all the light rays into focus on the retina. So what we're doing is we're taking a round structure of the cornea like this, and we're going to do some laser work in the center or the periphery, depending on the prescription, to get all the light rays into one point. We'll do that in a two-step procedure by reshaping, in order to reshape the cornea. We'll create a flap on the surface of the eye with a laser, pull that flap back down, or pull the flap back, do the treatment, and then put the flap back down. So some of the differences between LASIK today and LASIK in the past have to key in on how advanced the laser technology's gotten. You might have heard that LASIK used to cause halos, and we'll talk about that and why the modern day lasers don't have that as much. In previous iterations of laser, we only could treat the central part of the cornea. So we could only treat the very center of the vision. And if your pupil dilated to a point outside of that at night, you might see this little halo at night because there was part of your eye that was not corrected. The newer generation lasers, we can actually treat a lot further out, and so you don't get the halo at night. The other thing that we can do with the new generation lasers is we can treat your eye as if it was a thumbprint. So it's a very customized treatment, and that's called Contura in our clinic. There are several ways that we can do custom ablations. Contura is a way to basically treat your eye as if perhaps it was one prescription here and then a different one over here. Say it's a -525. And it's maybe a -575 here. Before, we couldn't customize this treatment, but now we can. We can actually take a thumbprint snapshot of the front part of your eye like that and treat it as if it were just your ablation, meaning just your treatment and removal of tissue. It's very customizable. That really limits aberrations at night. And a lot of people that have contacts and glasses realize what aberrations are when they're in that nighttime setting, when their pupils dilated. That's when the noise of your optical system really increases. We can treat those now. Patients come in to do a consultation. At that consultation, we're basically trying to figure out if you're a good candidate. What are your motivations for getting out of glasses? What are or contacts? Are you a good candidate? Is your eye healthy enough? Is your eye stable structurally to have LASIK surgery? So we're going to look at every facet of your eye and its health to determine if really LASIK is a good option for you. Very often you are. Once the consultation is done and a decision for surgery is made, during that period of time you'll get instructions on how to be during the day of surgery as far as your clothing when you arrive. Say you're going to have surgery at 8:30 in the morning. We typically do surgeries on Fridays, so people only need to take one day of work off. If you arrive at 8 o'clock for your 8:30 surgery, you could plan to be gone about 9:15 to 9:30. So the whole process takes about an hour to hour and a half of your time here. Somebody will need to bring you to surgery to drive you home. They can, if they choose, watch your surgery while you're here. Afterwards, we'll go over your instructions. We ask you to go home and keep your eyes closed for a couple hours. We do like to see you that very same day for a follow-up. The follow-ups generally are 1 day, 1 week, and 1 month post-surgical, at which point I'm the one that sees you every time. We will then decide what your follow-ups will be after that. Usually it's 3 to 6 months after that, and then a yearly eye exam after that. The expectation around vision and how quickly that recovers, usually the first day after surgery, you're a little hazy, a little foggy, but the very next day with traditional LASIK surgery, you're going to be able to drive yourself anywhere you'd like. The drops. People often ask about eye drops. They say, I'm terrible at eye drops. The drops following surgery are intense for the first week. We do ask you to use eye drops every couple of hours, especially artificial tears. The medical drops, one of which is a steroid, the other which is an antibiotic, you will use for 1 month at least postoperatively at a frequency of 4 times a day in the first week and then decreasing over the subsequent weeks. As far as activity levels, people ask, what can I do? We don't mind you doing any kind of low impact exercise. We do ask you to not be in windy environments or swimming for a couple weeks after surgery. You will have some sunglasses to wear for a good solid week after surgery, depending on if you have LASIK or PRK. I think the most important thing about choosing a LASIK provider is that you, the patient, feel comfortable with your provider and trust that they and their team are going to do a good job for you. When I counsel patients on day of surgery mentality and coming into the operating suite, which I think it's important to have one on site at your facility, the thing I tell patients the most is you have to just be in that zone that you know that everything's going to be okay. And I feel like that takes a level of trust and relationship that you have with your LASIK provider that gets you to that next level of comfort. And I've found that over the years that just counseling people on getting in that right mindset that they've chosen the right LASIK surgery center for themselves gets them to that place they're going to have the best outcome. With that said, here at Center for Sight, I'm the surgeon and I will see you pre and post-operatively all along the way. I think that's important that you see and ask who you're going to see post-operatively following your LASIK surgery.